Good day, good day, good day. I want to welcome y'all to the Lamp and Light Fellowship of Nurses channel. And the goal over here is to equip nurses and change lives. And I am Nurse Fran, and I'm the founder of Lamp and Light Fellowship of Nurses. One of the things that I do in order to equip nurses is I do offer one-on-one tutoring sessions for nursing students in the areas, mostly med-surg, but also pharmacology and fundamentals as well. So, the new semester is about to start, and also since the new semester is about to start, some of you may be going into clinicals, some of you may be graduating, and I want to give you some information that's going to help you to establish rapport with your patients. So that's like a good relationship, a good working relationship with your patients, right? Because that's going to be fundamental in your nursing career. The patients, because nursing is one of the most trusted professions. So when people look to us, regardless of the role you're in as a nurse, they're looking at someone they can trust. So that's, against other professions, whether it's like judges, lawyers, police officers, whatever. Nursing is one of the most trusted professions. And I don't think it would be like that if we didn't, have a working relationship with our patients. And I looked the word rapport up. It means a close and harmonious relationship in which the people or groups concerned understand each other's feelings or ideas and communicate well. So your objective, again, one of your objectives in regards to patient care is that you do want to establish rapport with your patients. It's going to literally, sometimes if you don't have a rapport with your patients, the patient's not going to like you. They're not going to want to work with you. They might ask to see another nurse, you know what I'm saying? So you want to obviate those things. You want to eliminate those things or try to stop them before they even start. Now, granted, everybody that you come into contact with, child, they're not going to like you, but nonetheless, you do want a good working relationship with your patients. And one of the first ways that you can do this is to introduce yourself to your patient. When you go into your room, introduce yourself to your patient. And, some textbooks even define the patient as their family as well. Because sometimes, the family dynamic is going to influence the patient care or the patient's healing process, right? So you're going to have to interact with with the patient's family as well. So you want to establish a rapport with them as well. So make sure when you go in, introduce yourself. They shouldn't have to ask you, when you go in, make sure like your name badge isn't turned to where they can't see your name or your face, right? Introduce yourself. In some patients, you might have to say your name more than once because some patients, they may have dementia or they may have problems with their memory. So definitely you want to introduce yourself. You don't have to go into your whole life's history. Most of the times, your first name is going to suffice. You walk into the room, I'm nurse so-and-so, I'm here to take care of you, right? Let me know if you have any questions. So not only do you want to introduce yourself, but also you want to make sure that you're making hourly rounds on your patient. You want to make sure that you are putting your eyes on your patient, right? You don't want to get to like the end of the shift and the patient may have had a question or they may have had a concern that never did get addressed because you hardly went into the room, right? But you're documenting on the sheets that you're going into their room hourly, and if you're not doing that, that's lying. So you don't want to lie. You want to be truthful and go in there and just, again, put eyes on your patient. So again, that if they have a question and they can start to feel comfortable with you and let you know what their cares or their concerns are, and you want to make sure that you can address them. Which leads me to the third point, addressing your patient's needs and concerns. Sometimes, and this can be something as, look, patient may be like, I'm thirsty. Can you give me something to drink? Get them some water. They may need to get up and they may need help going to the restroom, so helping them ambulate to the restroom. They may have questions about their procedures, right? And they want to talk to the doctor, so you can go call the doctor for the patient. Just whatever the concern is or the need is, make sure you address it. And if it's something that outside of your scope of practice, let them know that, hey, I can't do that, but I can get so and so to do it for you. Or look, I can't discuss these results with you, but I will get Dr. So and so to come discuss it with you. So if there's a question that they have, you don't know the answer, let them know, I don't know the answer. But when I find out, I will let you know. I'll keep you updated. So keep them in the loop. Keep them in the know about what's going on with them, which was the fourth point. Keep them updated, right? So when you get information in, and just let the patients know what's going on. You might have to call the family member and keep them abreast as well. Keep them in the loop too. So again, these are just ways that you can, again, establish rapport with the patients. And another thing, like when you go into your patient's room and you're about to do something, don't just start poking and prodding on anybody without telling them what's about to go on, right? If you're going to start an IV, let them know you're going to start an IV. If you're going to start a Foley or a catheter on a patient, let them know that beforehand, right? Before you do any type of procedures, explain what's going on. Before you give a patient a medication, let them know what medications you're giving them. And it's good to also educate them on the side effects of the medication. So if you start to experience such and such with this medication, let me know, because that's a side effect. Or it could be something that's an adverse effect. So if they start to having chest pain, or they're starting sweating, like that means that some of these medications might need to be stopped. So let them know what's going on, right? So definitely you want to explain procedures to your patients, what they should expect. And before you give the patient the medications, let them know what you're giving them. Another way you can establish rapport with them, advocate for your patients. Because some patients, they might not have the educational background, right? And they can't advocate for themselves. Because a lot of times in the hospital, you know, the upper admin, they don't look at the patient as a patient. They look at these patients as money or a source of income. So they could sometimes care less if the patient's needs are getting met, right? So that's where you come in. You want to advocate for your patient, because sometimes the patients cannot advocate for themselves. Sometimes they might not even have family around to advocate for them. So when you're in nursing school, you're going to learn that one of your roles as a patient or as a nurse, you're going to be an educator, and you're also going to be an advocate. So make sure you are advocating for your patients. And when you advocate for your patients, trust me, those patients, they're not going to forget you. They're going to love you for a long time. They're going to remember your name, because this is so-and-so, and she did this for me, or she went above and beyond for me. You're not doing that for the recognition, but you're doing it because that's what's right. So, which leads me to a point that I did not write on here, but act with integrity. Integrity means you do what's right when nobody's looking, right? You do what's right when people are looking. That means you just do what's right. You want to act with integrity in all situations. So these are just some tips on good patient care to help you develop your patient care skills, right? Because as a nurse, these are just skills that you're going to have. These are skills that you're going to have to work on. You cannot say that, or be in a patient care role and not providing good patient care. You cannot be in a patient care role or face to face with a patient and not, having good interaction or good communication with your patients. You have got to establish this, and once you start it or establish it earlier on, it's going to be easy to continue with it, right? So again, these are things that are going to help you out and help you establish rapport. And of course, one that I've already said, answer questions. Whatever the question is that the patient, if you can answer, if it's within your scope of practice to answer it. I mean, if they have questions about a procedure, if you don't know the answer, say, look, I don't know right now. And sometimes it's okay not to know. If you don't know, don't go lie, don't go making stuff up. Just tell them, look, I'll go find out for you, and when I find out the answer, I'll come back and let you know. So it's always good to answer questions and try to be as timely about answering questions as you can. Of course, you got to learn how to prioritize things, and some things can wait. but don't delay everything, because some things are simple and it can be taken care of like right then and there. It won't take you even 5 minutes. But if they have a question for you, and like, you shouldn't come back maybe 2 or 3 days later and be like, aha, I got the answer. No, you don't wait that long. I mean, so a lot of times some things are just simple, and it's a matter of Google. It's a matter of looking in your textbook. It's a matter of using a reference, right? Because some things you can just look it up and let them know. So definitely make sure that you are answering your patients' questions. And the last one for today, because I might do, other things, or come back with some more ways for you to establish rapport, but one that is very important in order to establish rapport with your patients is you want to educate your patients. And I said patients, but also you want to educate, good way to establish rapport, you want to educate yourself. You want to keep abreast of the nursing knowledge. So you want to make sure you're getting your continuing education. You're not waiting until the last minute at the umpteenth hour because you got to renew your license. It's due at 12 midnight or 11:59, and you're not trying to get your CEUs in an hour before, right? And just to say you did it. Don't wait till the last minute. And it's good to always learn, because nursing, even though the fundamentals change, medical equipment is always changing. They're always having new medications to treat this and to treat that, right? So things are always changing, so you want to make sure that you are knowledgeable about change, but also educate your patients about what's going on. Educate your patients, and not only that, you want to encourage your patients to educate themselves, because they're not going to be in a hospital forever, right? So it's good for them to know what medications they're taking. It's good for them to know why they're taking those medications. It's good for them to know when, right? It's good for them to know these things. It's good for them to know about their disease process. It's good for them to know, how they can treat themselves, right? So it's good, again, to educate them, because a lot of people love to say that knowledge is power. Okay, so we're going to look at it like that. So a knowledgeable patient, sometimes we don't like to see them coming because they ask a lot of questions, or they don't agree with everything. But it's good to have somebody that's going to be very active in their own care and don't just let you do anything to them just because of your role, right? It's good for them to ask questions. If patients ask questions, don't feel challenged. Don't feel like you got to stick your chest out, and don't feel like it's going to be a blow for blow or an all-out war because they want to know about what's going on with their body. They deserve that right? Just like you deserve the right to ask questions when you go to the doctor. Let them be able to ask questions as well without you being offended, because again, at the end of the day, it's their body, and we know from nursing school that according to those medication administrations, right, every patient has the right to refuse. They can refuse treatment, and they can refuse medications as well. But definitely you want to make sure that you are educating your patients. So that's the tip. So you want to just make sure that you remember these things, or remember these ways that you can establish rapport with your patient, because again, the new semester is about to start, and the sooner that you lay down anybody can lay down any foundation. Like, the word says that you don't want to be like the person who laid their foundation on the sand, and when the storms came and the rain came and beat upon the house was washed away. But you want to be like the wise person who built their house on a solid foundation, or a solid rock. So even though the winds came and storms came, they beat against the house did not fail. So you want to make sure that you're building on a solid foundation, right? So a solid foundation. Solid foundation is going to take you a lot of places. If this, if you have not subscribed to the channel, make sure you subscribe to the channel. And I'm going to ask y'all to do me a favor. If you like the message, you found that the information was helpful, please feel free to share it with some of your nursing friends. And also, please make sure to let me know what topics y'all would like to hear more about, like what disease processes you may want to hear more about, just let me know. Just let me know in the comments, and thank you for your time.